Now time for Quervain's.
I'm going to show you how to scan the first extensor compartment of the wrist. It's a location where we get Quervain's tenosynovitis. The patient position is supine with the thumb pointed up at the ceiling. So the skeleton model, we've got the wrist quite flexed just so the camera can see this a bit better. The landmark is going to be Lister's tubercle, which is this bony prominence on the dorsal radius. The orientation of the probe is going to be short axis or cross section on the distal forearm with Lister's tubercle in the center of the screen. The movements are then going to be coming around the corner towards the thumb and looking down at the radial-most aspect of the radius. Now the area of interest is going to be the collagen tissue just sitting on top of the bone at this spot. And so this is how we scan the first extensor compartment of the wrist.
Okay, now to draw it. So what do we see? Well, so again, we're now seeing the bone of essentially the radial, the kind of the thumb side of the radius. So there's bone. So that's what we're seeing here. Now, can you see tendon or can you see cartilage in this view? No. Fluid? No. So we're going to go straight all the way to tendon. So we know the tendon's going to be sitting here above the skin. So that makes it easier to say, well, the skin's up here somewhere. So this is essentially all tendinous tissue here. There's a little bit of muscle sitting over here, but that's it. You know, why don't we just draw that in for being thorough? Because this isn't actually fluid, it's actually muscle. Okay, so now we're going to clear that away, draw a bone one more time. So this is the bone of the distal radius. And as you can see, there are some irregularities here, right? the radius isn't 100% flat. We then move on to tendon. And again, as though it's not as easy to see, it's not as easy to see as a supraspinatus tendon. But again, here's our tendon tissue of the first compartment. Now there's two tendons, so I would actually draw them kind of like that. And then muscle, well, we know we've got a bit of muscle over here. Okay, it is now time to see what it's like in a live patient.
I'm going to show you how to scan and inject the Quervain's tendonitis. I usually like to have my patients supine with the palm about like so, almost like holding a cup. Some practitioners would prefer to have their patients seated across from them. But either way, I normally like to start on Lister's tubercle, which we see on the screen here. And this whole length is the second extensor compartment. Quervain's is the first extensor compartment, so we'll come around the corner, and we're now on the first extensor compartment, with the two tendons of the first extensor compartment being highlighted by the yellow arrow. My needle entry angle is going to be like so, and my needle will land superficial to the tendon and subcutaneous right where the needle tip is. There's an alternative way to find the first extensor compartment, and that's to start on the anterior aspect of the forearm by finding the radial artery. We can see it compressing just below the yellow arrow. And we can almost see the entire portion of the extensor compartment, the first extensor compartment, in the middle of the screen, whilst the radial artery is on the left-hand side of the screen. Once again, the angle of needle entry would be like so, and the needle would land right where that yellow arrow tip is. So those are two different methods to find and inject the first extensor compartment of the wrist.
Excellent. Now on to the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and And I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.